Hi everyone, it's Joe from the Mayfair Clinic. Today we're talking about PRP or platelet-rich plasma treatment. So platelets make up about 6% of our blood and they play an important role in inflammation and healing. So when there's a soft tissue injury, that could be tendons, that could be muscles, that could be ligaments, when there's an injury to that tissue, that causes bleeding and that causes the platelets to group together and they release granules which contain healing proteins known as growth factors. And these growth factors basically stimulate, first of all, the inflammation process, and then second of all, the following healing process. So inflammation is an important or necessary part of the healing process, but sometimes when injuries get stuck in that inflammation, that's when things start to become chronic. So with PRP, what they do in the lab, or they take some of your blood first of all, and then they spin it in a centrifuge really quickly, and that separates the platelets. So then now they have a high concentrated plasma of platelets. And what they do is they inject that back into the injured area, and the theory behind it is that those high concentrated level of platelets will start to stimulate that healing process because they've got loads and loads of those growth factors, those healing proteins in there, and that will help to speed up the recovery of the area because it's going to help to get past that inflammation process and then get into that repair, that healing phase of the whole healing process. So far there's only been small scale studies, some on humans, some done on animals as well, but with some positive results. There are some with negative results as well, so it's difficult to say how effective the treatment is just as yet, but perhaps why it's been so popular and why a lot of people are starting to read up a lot about it is because there's been some high profile athletes, particularly in America, baseball players, basketball players, some elite runners as well, have used PRP to help speed up the recovery, and when they use it, they really start to praise how much it does speed up their recovery. Obviously all of that evidence is just anecdotal at the moment, but with those case studies in place, research is promising and it will be ongoing. There will be more larger scale studies as time goes on, but so far it's difficult to say how effective it is. So before you go and book yourself in for a PRP treatment, make sure you go and do your research first. A lot of scientists and researchers are saying that there are a lot of environmental factors such as age, level of exercise, diet, smoking, air pollution, those kind of things that can reduce the effectiveness of PRP treatment. So although there's been a small amount of research so far on PRP, I think once there's larger scale studies, big clinical trials on humans, I think that we will start to see more positive results, especially with tendon injuries. So there's good reason to believe that in the future PRP treatment will be effective. Check out the article on the website.